Hello, my name's Adrian Richards. I'm a plastic surgeon and also the Surgical Director of Aurora Clinics, which is based here in the United Kingdom. In this very short video, I'm going to be talking about nipple reduction techniques. Now, it's important to differentiate between the different areas of the nipple. The nipple itself is known as the nipple. The brown area around the nipple is called the areola. So when you're considering nipple reduction techniques, it's important to differentiate between whether it's the nipple that's the problem or whether it is the areola itself. So I'm going to talk a little bit about abnormalities you can have in the nipple in females, and in the subsequent video I'm going to be talking about abnormalities you can have of the nipple in males. So first of all, in females, abnormalities with the nipple itself. The nipple can either be too big, too small, uneven size, or inverted. So these are all variations that can occur and are very, very common. So I've talked a lot about inverted nipples in other videos, and please look at the inverted nipple section of the website if this is an area of concern for you. If you feel your nipple is too large, that's too protuberant, this can be reduced. Many of my patients sort of say they are concerned about the appearance of their nipples. They feel they're too large, they stick out too much because they make it difficult wearing tight-fitting clothing, and this is males and females. So the nipple itself can be reduced in height by an operation under local anaesthetic, which essentially reduces the top of the nipple, reducing its vertical height. The nipple can also be reduced in diameter, and this is done by removing a wedge-shaped area, almost like a piece of cake, from the nipple, and then this is sewn up and it sort of brings the nipple in, reducing the diameter of the nipple. If you feel your nipples are too prominent or they're too large, both of these can be corrected very simply under local anaesthetic in a procedure that takes about 30 minutes for both nipples. Abnormalities in the shape of the nipple can also be corrected. Some people have little nodules on the top of the nipples. Some people's nipples are irregular, they're not round. Some people feel as if an area of their nipple is too protuberant. Again, each of these is very individual, but they can each be addressed under local anaesthetic with the nipple reduction technique. So they're really all procedures aimed at modifying the appearance of your nipples themselves. The areola is a different area, and I'm going to talk about what can be done for the areola in a subsequent video, and I'm going to be discussing areola reduction techniques, making them less puffy, reducing them and making them more round. So thanks very much for watching the video. I hope you found it useful and informative. Please watch some of the other videos in our series if you feel as if there's any condition there that you may like to gain further information on.